probably shouldn't have been looking at it when you turned it on. Well, good afternoon, Queensland. It's so wonderful to today be launching our new Inform My Care website. The Palaszczuk government committed to more transparency around health data and information. We have spent the last 2 years working with consumer groups to hear from them directly what information they want from websites. Now, we know that states produce data every year around performance, and our performance data for the Queensland hospitals will be released today as well. But what consumers really want to see is what services are offered at each of their hospitals. How does the services available at their public hospital compare to the private hospital in the same area? What's the average wait time to get into the surgery, but also what's the average time that they're likely to spend in hospital when they have that particular type of operation? Does this hospital provide maternity services? What's happening with aged care in their area? What's their nurse to patient ratio? What's their care hours? We called on private aged care with our transparency legislation passed in 2019 to buy into this website, in that we want them to be as transparent as the public system to show their staff ratios and care hours. Now, we have invited all 494 private aged care facilities across Queensland to put that data up, the same as the 16 state government-owned aged care facilities have. 84% of those aged care facilities, 384 of them, have chosen to opt out and not provide that data. I strongly encourage them to be part of this website, be part of sharing this information, being transparent, because consumers want choice and consumers want confidence in the quality of care that they get. And the way you give them that confidence is by providing them with this information. This is an Australian first. It is a one-stop shop of knowing what our public and private hospitals and public and private aged care facilities provide. And we are very proud of this website. It will continue to be built on as time goes on. We will get feedback from GPs and consumers. Are there more information or improvements we can make to this website? But so much work has gone on, and I want to thank the Department of Health for their incredible work. And I also want to thank Melissa Fox, Chief Executive from the Health Consumers Group, and also Nola, who's been working on the consultation. I might just ask Melissa to just say a few words about the consultation and what this website means being launched today. Thanks, Melissa.
Well, I'm absolutely delighted to be here today on such a landmark day, which we've been working towards together for over 3 years. Some might call Minister Darth courageous for releasing the information that you can find online today, and they would be right. Can I be clear that any opposition to today's website and this sharing of information to the public must be scrutinised through the lens of the vested interests of politics, profit, professional protectionism and paternalism. For what is being launched here today is what Queenslanders have said they want to be able to make decisions about their health care. It will improve health outcomes for Queenslanders. The focus on aged care is extremely important given the horror stories that we've seen through the Royal Commission. Shining a light on all corners of aged care is vital so that older people are given the dignity and the care that they need towards the end of their lives. Private RACFs must deliver on their moral obligation to publish statistics on ratios of staffing, and we call on all 100% of them, private and public, to do so. While we acknowledge the long road to get here, we don't want it to stop here, and we look forward to working with the Queensland Government to increase the number of indicators available to support consumers to make decisions. Public reporting on ratios in RACFs are only the first steps for aged care. Accreditation results and patient outcomes for RACFs should be next. For hospital services, we would love to see accreditation detail, services and patient outcomes for mental health and for community services. We acknowledge the hard work of all 300 plus consumers who have been involved in 3 years worth of kitchen tables and focus groups and sitting on committees and testing the website, and we look forward to supporting them and Queenslanders to use this information, the envy of consumers across the country, to make decisions that are right for us. Nola, would you like to speak?
I've been invited here today as a consumer representative, and I'm part of Health Consumers Queensland. My role on this development of the website has been amazingly interesting, and at all times I felt the consumer has been involved and encouraged, and the input has been well respected. I see it as a starting point. I see the role of us as the advocates of consumers to get our consumers to make use of this website, encourage it to grow, and to encourage those in the community to make use of it at all times. It's a great step forward and it's extremely interesting, and I thank you for the opportunity.
So if we can just take questions on the Inform My Care first, and then happy to move on to talk about other matters with the Chief Health Officer. So it's not a requirement to provide all of that, but it is. There has been, quite a sufficient amount of information being provided, but we want this to be expanded. So we want private hospitals, and I think, once they see this site fully operational, once their patients and their family members of the patient start having those discussions, because this is about starting a conversation. This is about starting a conversation at all of these hospitals and aged care facilities, going, we want more information, and we are giving them the platform. We've built the platform to start the conversation. We want them to share as much information as they possibly can, and that includes the patient's experience. So let's have a look at what the patient experience and the surveys from patients have been in relation to the hospitals and the services that they've provided there.
How disappointing is it that 84% of those private aged care providers have opted out?
Look, off the back of the Royal Commission into aged care, I really would have thought that aged care providers would see the benefit in giving the public confidence of the service they provide, because they need that confidence right now. With the horror stories, as Melissa said, the horror stories that have come out of that Royal Commission, the public want to know that when they put their loved one into aged care, that they're going to be cared for properly. And this gives them at least some confidence, knowing the staffing ratio and the care that's being provided. So I see huge opportunities to build on that in aged care, but this is a pretty basic set of data, a really simple basic set of data that we are asking aged care to provide us, and to find 84% have said no, then it's up to consumers now. Start the conversation with your aged care facility. On this? No, so we're just dealing with this. Yes, sorry.
I mean, obviously it's very promising to see all this data up there. There will be some critics of this website who say it's very old, quite old data being 9 months old. Does that
look,
it's usability and what's
no.
the plan?
So look, the data is 9 months in arrear, but quite often, and we see from the Commonwealth, they publish annually. So once a year, some health data. We will bring this down to 6 months. So we will report and update this website quarterly. So every quarter it will be updated with new information, and also we hope to bring that to only 6 months in arrears. So 6 months, the sorts of information that we are publishing is not something that's likely to change significantly within that time period. So the public can have confidence that this is current data that they're looking at to inform their choices.
You said earlier too that some of the information would be confronting around medical complications. Can you talk about hope that actually changes?
Look, what we know is when there's transparency and accountability around this sort of data being reported, it leads to better outcomes in quality care. That's known globally. So what this does is, yes, it lists complications, and I encourage people when they're looking at that to also look at the explanation of what that means. So when we talk about particular complications, it's not necessarily because of an error. It could be, but also could be that because of this person's chronic illness, that there's been complications in relation to their surgery and their health condition. So it's just being very open about the types of complications, and statistically, so someone's going in and having major cardiac thoracic surgery, what's the percentage of complications that occur with that type of surgery? That's the useful information, because it's pretty daunting to go into hospital with any sort of surgery, but to actually be able to look and go, oh, well, actually, the complications in relation to this surgery is quite low. You know, I shouldn't worry too much, you know, or for family members to look at that. That's the sort of knowledge that the consumers are going to be able to get out of this information.
New South Wales has live hospital data as a different data set, but has there been any work in that space to make a single system up here to add to this?
Well, this is the most comprehensive one-stop shop of health data in the country. In the country, where it's got public and private, both hospitals and aged care. So as I say, we'll continue to learn and build on this, but we are the first in the country to have this sort of data all in one place, easy to understand and very easy to use. So I do encourage everyone to get onto the Inform My Care website and have a look at it today.
Why not do live data?
Oh, look, there is a massive amount of data. You've got to remember that by the time they collect it, it's already dated. So by the time they actually get all this data, upload it all, it's all double checked as well. So once the data's uploaded, they go back and check with all the hospitals. Is this accurate data? Has there been any errors in inputting this data? Because it's really important of the accuracy. Accuracy is everything with this data. So it is important that we take time, and it is a huge amount of work to get this volume of data, every single hospital across Queensland and aged care, all of this data in, that inevitably it can't be real time as at today, but it is, as I say, very current data that will be updated every quarter. Sorry, any other questions on the Inform My Care? Okay, so I might just also go on to an update on New South Wales. So there is a new case, a new community transmission that's been reported in New South Wales today. This is the second community transmission, and we have heard the comments from the Premier of New South Wales that this latest transmission appears to have been through fleeting contact. Fleeting contact. This is one of the highly contagious variants that is being transmitted down in New South Wales. We had already put in place restrictions in relation to people who have been to an exposure site, and we continue to say to people in Queensland, if you've travelled to New South Wales in the last couple of weeks, please check the website for those exposure sites. Both Queensland, we have the links, and the New South Wales website, you can find that information. But I can announce that because of this new case, as of 1 a.m. tomorrow morning, we will be declaring the local government area of Waverley a hotspot. So that means that you will need to go on to the website and apply, if you are a non-Queensland resident, for a travel border pass, and apply for an exemption if you do want to apply. And if you get that exemption, you will be required to go into hotel quarantine. Any Queenslander returning from that LGA will need to apply for that border pass, and will also be required to go into hotel quarantine. This is really important. It's a highly contagious variant. There is community transmission in that area, and we believe we need to act quickly to just ensure that we don't have any of that transmission coming up to Queensland. So just to be clear, the changes we're implementing from 1 a.m. tomorrow morning is anyone who has been in the Waverley area for the last 14 days will not be able to come to Queensland unless they have a border pass exemption, and if they are granted an exemption, they will need to go into hotel quarantine. I want to acknowledge our travel declaration pass is working exceptionally well. It goes live 1 a.m. tomorrow morning. We already have over 22,000 people who have applied and got their declaration passes to travel into Queensland just over the weekend. Just on Saturday and Sunday, we've got over 22,000 people coming to Queensland. I want to thank all those travellers. This is wonderful news. And I can also report that the work we've been doing, people are voluntarily coming forward and advising that they have been to an exposure site and going into quarantine. So we thank those people. The Chief Health Officer can give you the number. I think it's 17 people now have come forward and said they've been at an exposure site, and we thank them for doing that. I'll just pass over to the Chief Health Officer now. Thank you, Dr. Young. Thank you.
Right. Yes, so as you've heard, as of 1 a.m. tomorrow, because of these new cases that have occurred in the eastern suburbs of Sydney, Queensland is declaring Waverley local government area as a hotspot. So anyone who's been there, unless they're a returning Queensland resident or seek an exemption, won't be able to come into Queensland. Anyone who does will need to go into 14 days hotel quarantine. And this is because New South Wales has said that their two most recent cases linked back to the limousine driver have had fleeting contact. They are doing further work to look at CCTV footage, etc., to see if there was any further contact, but at this stage they're saying they believe it was fleeting contact, which is why we need to do this. It is really important that anyone in Queensland reconsiders their need at this point in time to travel to anywhere in Sydney. So the New South Wales Premier has put restrictions back in place for Greater Sydney, mask wearing on public transport, for instance, and made various other recommendations. So we know that these cases that have been found in Sydney have travelled widely through Sydney, but there hasn't been any other transmission events outside of that Waverley local government area. So at this point, the restrictions for travel into Queensland are only if you've been into any of those sites that have been notified by New South Wales Health, or if you've been in the Waverley local government area.
Dr. Young, can you just clarify your advice then to Queenslanders maybe wanting to go south to Sydney?
Yes, so people need to reconsider whether or not they should be travelling to Greater Sydney at this time, and they need to be prepared that they may need to, when they come back, go into government hotel quarantine for 14 days. We're putting it in place from 1 a.m. tomorrow, and then we will just see what happens in Sydney. So they've got a number of exposure venues that they are very concerned about. They have a lot of people that they've put into quarantine. If they see future cases in people that are in quarantine, that of course is not a concern. That's excellent contact tracing, and we know New South Wales is very good at contact tracing. It's when they find people, as they have today, who've become a contact through fleeting exposure to a confirmed case, so they weren't in quarantine, and they've been to a lot of venues. So this most recent gentleman who was in Myers, and it's believed was there at the same time as the limousine driver, but they can't see where the contact actually occurred. He has been to many different places throughout Sydney.
Do you have any information about a possible hotel quarantine breach? Here a guy apparently tried to run away.
Apparently, yes, a gentleman did try to climb out of the balcony that they were on and then fell and was taken to the Cairns Base Hospital, and I understand does have some injuries.
Just on Cairns, there's been reports of a family from regional Victoria who went on a shuttle bus and they had to go into quarantine. Can you explain why they've had to go into quarantine when they were just on that shuttle bus?
Unfortunately, we know with these variants, both the Delta variant and the other variants, that they are very contagious. We've seen that in Sydney. So going onto a shuttle bus is actually quite a risk, because the other people on that shuttle bus were from Melbourne. So that's the issue. So I have been saying for the last 18 months that when you're in an area that is not a hotspot and you need to travel through an airport that is in a hotspot, you need to go directly, not on public transport, to that airport. Otherwise, you're then unfortunately captured by the direction. So it's very unfortunate for this family, but they will need to be in quarantine. Of course, they can make the decision to leave and return back to Victoria if they choose to do so.
Were other people on that shuttle bus allowed into Queensland?
I don't know the other people on the shuttle bus. They won't necessarily all have gone to the same flight. They might have gone to different flights. I don't have that information. It's just that I know that that family was on public transport. A shuttle bus is public transport.
Deputy Premier, ever raised concerns with you or sought your advice about how safe AstraZeneca is for women 50 to 59?
I've spoken in great detail to the Premier ever since the vaccines were first discussed about a whole range of issues related to the vaccines.
What's your advice now?
My advice is the national advice that was announced by ATAGI yesterday, which is if you are under age 60, so 16 years of age through to 59 years of age, you should preferentially now get the Pfizer vaccine. There isn't a ban on using AstraZeneca in that age group, but I strongly recommend that people follow that advice and get the Pfizer vaccine unless they've already had one dose of AstraZeneca. Then for people who are aged 60 years of age or over, they should continue to get the AstraZeneca vaccine unless, of course, they're in one of those cohorts that we want to be rapidly vaccinated. So they are the essential workers, the healthcare workers, our quarantine hotel workers, border force workers who are in 1A and 1B, or they're First Nations people, or there are others. So there are some exceptions, but the vast majority of people aged 60 years and over should get the AstraZeneca vaccine. Now, anyone who has had one dose of either vaccine, whether it be Pfizer or AstraZeneca, must get a second dose of the same vaccine. The TGA has not approved nor endorsed any mixed vaccination schedules. The evidence for that is not yet available. So it is very important that people have 2 doses of the same vaccine. Now, it is safe to have a second dose of AstraZeneca if you've already had a first dose. So the UK has now given an enormous number, millions and millions, of second doses, and they have found that there is a slightly increased risk of clotting of 1.5 people per million doses for second dose. So the second dose risk is very, very low compared to the first dose risk.
Has the cap should have been lifted to 60 sooner?
The decision was made by ATAGI, who is the Australian Technical Advisory Group on Immunisation that is responsible for advising the Commonwealth Government about all issues related to vaccination, and they found the Australian data was supportive of changing that age level. ATAGI has been very, very closely following all of the information, and it's really only in the last few weeks that they've seen people in that 50 to 59-year-old age group having those increased complications. So they've been following this very closely and made that decision yesterday.
Just on the Sydney travel restrictions, for anyone arriving from Waverley before that 1 a.m. cut-off time, what happens to them if they come into Queensland?
If they've been in any of those notified venues, they need to go into hotel quarantine. That's the current position. And indeed, they need to seek an exemption unless they're a returning Queensland resident or have one of those in one of those categories. That's prior to 1 a.m. After 1 a.m, it'll be anywhere in Waverley. Prior to 1 a.m, it's only the venues.
Sorry, just to clarify, had the Premier raised concerns with you prior to this?
The Premier has spoken to me in great detail about vaccination. She has been very interested in the whole vaccine process, and of course she's also been speaking to the Prime Minister through National Cabinet and to her colleagues, so she's been getting detailed information.
Respectfully, that doesn't answer the question. Did she raise concerns with you? you?
She has raised concerns with me about all vaccines, because there are a lot of questions about all of these vaccines. They were produced, as we all know, very quickly, and so there have been concerns about that, and I've been able to reassure her about the systems in place, and that Australia has a regulatory body, the TGA, that looks at all of these issues and talks to co-regulatory bodies around the world about them. So yes, the Premier has raised issues with me right from the start about all vaccines. So I have discussed all of the vaccines with her. So the mRNA vaccines, we know there were concerns about those because they're using a new technology. About the clamp technique that UQ was using, the Premier has kept herself fully informed about all of the vaccines that have potentially been available now for around a year. I'm always worried about vaccine hesitancy, but I'm really pleased I'm here in Queensland because we know that we have a very, very good community that is well informed, and more than 95% of our children get vaccinated, which is a really good start.
Are you worried about the lack of incentive for people to take up vaccines? Because we see cases where people in Melbourne who haven't been to hotspots but are fully vaccinated can't come to Queensland. We see that couple who've come in from the US, they're here on compassionate reasons, fully vaccinated, tested negative multiple times, but still a compassionate, organisation can't be found for a reason, can be found to let them into Queensland. People see that and they think, well, what's the point in me getting vaccinated quickly?
The point of getting vaccinated is to save your own life. That's why I've got vaccinated. This is a vaccine to be selfish about. We know that if you personally are vaccinated, you are very, very, very unlikely to die from getting a COVID infection. But you can still pass it on to other people. That's why being vaccinated isn't enough to stop the requirement for quarantine. So being vaccinated will save your life. I think that's a really important incentive, a really important reason to be vaccinated. We don't know where our next case of COVID will arise. We really don't. We've seen that time and time again. It just pops up. So it is important that as soon as you are offered a vaccine, you take it up. That is really important. You take it up for yourself. Now, normally I talk about vaccination as being a community responsibility. You're getting vaccinated to protect other people. That's not really the case here. You're getting protected to save your own life.
We've got to go for us. So can I ask, sorry, the $482.5 million in the budget to ease pressure on hospitals, how exactly will that be spent? What's it being spent on?
Oh, well, I've already outlined some of the initiatives that our funding is going to, but but what the 482 is it's an increase in the budget across our HHSs to assist them in a whole range of initiatives. It's the Hospital and Health Service that will decide. Sorry, I've just got a cough. Sorry. So, the Chief Health Officer's looking after me. You can't get any better care than that, I don't think. So our funding, we've already announced the $100 million, which goes to a whole lot of initiatives, but this additional funding in the budget is also to go towards things like staffing issues, where there's need for increased staffing, but also it'll go to purchasing extra activities in elective surgery. We've committed a lot of funds already to, and you'll see in the performance data, to increase our elective surgery numbers, and also things like our transition nursing. So we've got our nurses who are working in our emergency departments, whose particular role it is to work with our paramedics as they arrive and to triage and to get those people into the ED, into a bed and treated so we can release the ambulances. So some of those money will go to those initiatives, but it will go to a whole range. This is part of the normal budget.
Quarterly health data. Can you tell us what we can expect to see in that quarterly health data? Because we haven't seen the data.
Sure. So what you'll see in the performance data for the last quarter is that the data reflects what we're seeing on the ground. over an 11% increase in presentations in our emergency department. You will see an increase in the number of surgeries that we are doing, and you will see extra demand happening there. So what you'll see is what we've been talking about for some time now around all these pressures in the system and the data reflecting that. You have to remember that a lot of this data only goes up to February and March, and the next quarter data, of course, will be released when it's due, but it will show that we're experiencing significant demands across our system, and that's what this data will show. Thank you.
Has there been any update with the Victorian couple since you posted it?
Oh, thank you.
In terms of the investigations, have they been interviewed yet?
So I'll leave that to police to report on. The police are undertaking that investigation, and I'm sure they'll update us shortly on that. Thank you.
Thank you.
Thank you. Yeah,